Welcome back to Clean and Comfort. We have been away and now we're back, and Liz and I are practicing social distancing. I am in the studio and Liz is currently at home. Our last podcast, we had Dr. Linda Carr, specialist in Philadelphia of public health, who will be back in our next podcast. But right today, Liz and I will be discussing our challenges and experiences at our hospitals. Hey, Liz.
Hi, you're on with Dion and Liz. We are back together on our podcast after what seems to be a long 8-week break. We were on the front line of the COVID-19 response in the epicenter of New York City, an area that was hit very hard with COVID-19 patients. And we're back together again. It feels good to talk to one another again and know that everything is okay with our families. And how are you doing, Dion?
I'm a little tired because this COVID-19 really makes you even work harder than anybody can even imagine. I know even wearing masks and all of these things throughout the hospital all day long, it's exhausting. It's have you gasping for breath all day.
Right. I know we were in constant communication and sharing best practices and talking about the emotional and physical well-being of our team members and making sure that their safety and our safety was paramount. So it's good to be back together again and have some decompression and some time to review everything that has happened and make some changes to our current practices to be able to respond to future pandemics, future outbreaks, and be able to keep our team safe.
I know.
And yeah.
So, adjusting to the unknown is one of the hardest thing. Like our cleaning practices. Thank goodness our practices were on point for the most part, because some of the chemicals they're suggesting that we use, we have already been using, and plan to talk about those chemicals on a further podcast. But today, let's just discover and talk about our stress and our staff stress and the different things that we have done or we can do to help relieve them.
Sure, I agree with you. Our teams were pushed to the limit, and if they were not so well prepared and well trained to respond and well trained to clean isolation rooms, we would have never been able to have the overwhelmingly wonderful and amazing response that we did by all our environmental service team members. They truly did an amazing, amazing job. We're so very proud of them.
I remember being afraid. And at the first onset of it, waking up one morning.
All the unknown.
All of the unknown. Yesterday it's this, and the next day is this, and it stays in the air for 3 hours. It's very scary.
Yeah, there was, a lot of information changed day to day, and our hospitals were following CDC best practice and new guidance, and we just kept trying to update our team members, updating our training job aids that we had to quickly create, and make sure that we had the right amount of PPE and talk about PPE conservation. And yeah, a very scary time for all of our team members, and very scary.
Yes, I know. It's still scary, but as long as we know what we're doing, what we think we know what we're doing, because we still don't know the bottom line of it. One thing I wanted to point out is, we live in New York, and one of the spaces that was the epicenter of New York, the first places that it started, I live about a mile, maybe 2 miles away from there. And, I travel those roads daily. So you can imagine what's been going through my mind during my journeys and travels.
Yeah, I think that I was okay. The first couple of patients, first couple of room cleans, and then when we began to get an increased census and increased cleans and isolation terminal requests for cleaning in the emergency room and cleaning in radiology. Radiology saw almost every single COVID-19 patient that there was admitted to the hospital or that was seen in our emergency room. A lot of imaging done, a lot of traveling through hallways and spaces, and of course up into our patient units and our intensive care units. So very scary time. I think for me, the most scariest time was when a very young patient was in our ICU, was intubated, and I think it really hit me that this could impact me, impact my family, impact our team members and their families. So very, very scary time. And we ended up having staff members on the front line that became sick and were out for a long time. At one point, our team here had 17 people out. I can only imagine what your larger campus had. Do you remember how many people that you had out and sick?
We lost track, to be very honest. Stopped counting. We just focusing on making sure that no one else got sick. But it's the simplest things that we believe, traveling in public transportation, simple, being at home around others that really didn't understand what it was, because no one understood. And all of this happened early in the game. So later on in the game, when everyone understood it, they began wearing the PPEs, even on public transportation.
Yes, very confusing time on what PPE to wear, and some people were wearing masks and others were not wearing masks. And, I saw, and we appreciate all of our essential workers, not just essential workers that are on the front line in hospitals and nursing homes, but also if it wasn't for the MTA keeping the subway system running and Metro North keeping the railroads running, a large portion of our employees wouldn't have been able to make it to be a first responder. So we're certainly appreciative of the efforts of all the first responders, but some of the early cleaning and being prepared and ramping up the cleaning of the subway system showed a lot of poor practices of cleaning and disinfecting. So I know on our webinar series that we are thinking of recording, and on our podcast, that we want to talk about tools and best practices, that we want to talk about being prepared now and in the future, and how we prepared and ramped up our response to cleaning with this COVID-19 pandemic. I also know that we want to talk about infection prevention, cleaning and disinfection, and that we want to talk about specifically, I think needs addressing, is air exchanges and how long a person has to wait to enter into a negative or non-negative pressure room to clean after there's been an aerosolizing procedure. So there was a lot of confusion and different thoughts on cleaning of these rooms. So I think air exchange is going to be something that we need to focus on as a system to make sure that our team is safe when cleaning, and that after disinfecting surfaces, they're not recontaminated.
I think all of that comes with testing, real testing. Have someone in the room after the cleaning, testing the surfaces, and swabbing the room and sending these items out to the lab. That's the
Right.
only way we will find out, in my opinion.
And you often talk about, how do we ensure that a room is really clean even after the best of practices are being followed, and how is every surface disinfected, and how can we ensure that so we do not have to worry about patients, staff, and other surfaces being contaminated from surfaces that were not cleaned and disinfected well enough. So I know that we're going to be having more conversations about validating the surface cleanliness in the future.
And I think it's about validating it, that what we're doing is the best practice. We try something, test it, validate it, and move with it. Because if we're just doing it without validating, we're just spinning our wheels. And COVID has shown us that validation is and education is so important, as we always talk about, as we push towards the future. I know you and I are the head of the needle when it comes to education. You mentioned PPE, and during the last interview, we interviewed Dr. Carr from Philadelphia, and she talked about PPE. And
so Dr. Carr is both a professor and a doctor that specializes in public health in the Philadelphia area. And I really want to hear more about your podcast with Dr. Carr.
Yes, and she talked about PPE and poor usage of it, and she's going to come on and discuss that a little bit more. And we were so happy to have her on. I know you couldn't make it that day because you were in the OR till 12 midnight. So we decided to go forward with the podcast. But we missed you there.
I would have loved to have been part of that, but I know that you have a close connection with Dr. Carr, and that we'll have her back, and we'll be able to talk to her more and get her insight and learn more about how she helped the fight against COVID-19 in the Philadelphia area.
Yes. So let's talk about our staff. I know a lot of them were afraid, very afraid of what was going on, didn't want to go into the rooms until all of us suited up and went into the rooms with them. It is scary, and it still is. And, looking forward to the next podcast, we want to get our leaders and professionals, some of our vendors that help provide some of these chemicals and cleaning products that we always talk about, on to discuss some of these items.
Yes, I think that would be a really great idea. Learn more about how others responded and helped and assisted in the response and cleaning efforts. And a lot of our response was great because of our specialists and our team members that work in procurement, working to get all these supplies and deliveries in for us and help us ramp up our disinfecting materials and all of our wipes and everything that we needed to be able to respond, and especially all our PPE. I know in environmental services and many other disciplines, we needed goggles to be able to clean these rooms. We needed eye protection and shields, and we needed, of course, N95 masks. But it was a very scary time, and also, you can't just hand someone a pair of goggles and an N95 mask and ensure their safety in cleaning the room. So there was a lot of work done quickly by a lot of people within the environmental services team at our hospital at an enterprise level, where we worked together to develop some really great training tools and job aids for specific cleanings and tasks when there was either a confirmed case or a person under investigation for COVID-19. So, yeah, we had to really step up and